Hello, my name is Bryan Martinez, and the community-based organization that I will be doing a public service announcement on is the Human Services Association. So, the Human Services Association targets the population that is primarily low income. So, this would be low income families, children, adults, and senior citizens. And the health behavior that they're targeting is unhealthy eating, low physical activity, as well as those who might be overweight. So the problem is that underprivileged low-income individuals are more likely to face difficulties with insurance coverage, accessing health services, and an inability to cover healthcare costs, which, as a result, leads to higher risk for certain health outcomes such as depression, diabetes, heart attacks, low birth weight, and a shorter life expectancy. The Healthy People 2020 objectives being covered by this organization is access to health services, early and middle childhood, educational and community-based programs, health-related quality of life and well-being, injury and violence prevention, social determinants of health, nutrition and weight status, and older adults. So an overview of the Human Services Association is that the type of organization that they are is a private nonprofit one, and their mission is to provide families with compassionate and comprehensive care to promote wellness and build strong communities. The vision is that families are safe, healthy, happy, and thriving in their community, and a brief history is that they were founded in Bell Gardens in 1940 as an outreach effort of the Presbyterian Church USA, and all of its services have been administered on a non-sectarian basis since 1975. So staff and volunteers provide services through collaborative work with community members, and programs, education, and services that they provide include nutrition and health workshops, health enrollment services, child development programs, caregiver and outreach programs, senior services, and family preservation. The way that this organization markets themselves is primarily through their social media, like Facebook and Twitter, their own website, of course, and community events. A few strengths of this organization is that they have various locations across California, a variety of services for all ages, young and older, and as well as a high engagement with community members. And for weaknesses is that they don't market it themselves enough, and they primarily target just one population. A current program that they implement is the Supplemental Nutrition Assistance Program Education, also known as SNAP-Ed, and the goal is to increase consumption of healthy foods and drinks, increase physical activity, and improve food resource management. And they have various objectives which are to be completed by September 30th, 2019, and they include improving diet quality of meals and snacks consumed by SNAP at eligible population, increased consumption of fruits and vegetables, and decreased consumption of added sugar from food and beverages, as well as increased time spent in physical activity among this population by 3%. An additional objective is that annually, at least 30% of surveyed SNAP-Ed adults, resource management participants, report increased food security. The way that this program operates is by teaching people using or eligible with SNAP about good nutrition and how to make their food dollars stretch further. This program has been running since 1988, and currently there is no data provided on the website due to increased rates of negative health outcomes. For cultural competence, what would be needed to work at this organization and with this program would ideally be somebody bilingual, somebody who has effective communication skills and understands the target population and behaviors. The way that the CBO has worked on it is by having child, mother, and elderly care design and color on their website, community input on programs, as well as organization members being a part of the target population. For your leadership and key contacts, I have provided the organization's location that was used, so the Human Services Association in Bull Gardens, as well as their website and the executive director at this location, and a program contact. And these are my references.